Welcome back to Rants for Democracy, where we expose the lies, break down the chaos, and fight for the future. No fluff, no filter, just hard truths and real talk about the state of our democracy. My name is Nicole, and today we're covering an allegedly explosive story that's been shaking up Alberta's political and healthcare landscape. The alleged Alberta Health Services scandal involving allegations of political interference, corruption, and the role of Premier Daniel Smith. Now, before we dive in, I want to make one thing crystal clear. These are all allegations. Nothing has been proven in court, but the details are enough to raise some serious questions about transparency, accountability, and the future of Alberta's healthcare system. Alberta's healthcare system is no stranger to controversy, but this time things have escalated with allegations of political interference and corruption within Alberta Health Services, or what's also known as AHS. At the center of this alleged scandal is the abrupt dismissal of the former CEO of AHS. Now, why is her firing such a big deal? Well, according to her legal team, she was allegedly terminated after launching an internal investigation into some highly questionable contracts awarded to private surgical providers under the Alberta Surgical Initiative. What makes this even more alarming is that these contracts were allegedly given to companies with political ties to government officials. That's right. There are allegations suggesting that for-profit surgical operators with cozy connections to the Alberta government were getting preferential treatment in contract awarding. But again, these are allegations and nothing has been proven yet. Now, this isn't just about one CEO getting fired. This ties into a much bigger picture of political decisions and alleged interference in Alberta's healthcare system. Since Premier Daniel Smith took office, her government has aggressively pushed for healthcare reforms. We're talking about moves towards privatization, alleged political appointments, and restructuring efforts that critics say destabilizes AHS. Healthcare workers are frustrated, patients are experiencing way longer than normal wait times, and the system feels increasingly strained. Critics allege that these reforms aren't just about efficiency, they're about funneling public funds into private hands. The firing of Dr. Verna Yu back in 2022, for example, allegedly politically motivated because she didn't align with the government's pandemic strategies. So when the CEO starts investigating private contracts and gets fired shortly after, it's not hard to see why people are raising eyebrows. The timeline is pretty suspicious. Again, allegedly. Premier Daniel Smith isn't staying silent on this. In fact, she's come out swinging, calling the allegations false, baseless, and defamatory. Strong words. She's requested Alberta's Auditor General to investigate the AHS procurement process. She says her government welcomes transparency, that they're not afraid of scrutiny. But here's where things get interesting. Critics allege that Smith's response feels more like damage control than genuine accountability. So let's break that down. First, there's a lack of direct accountability. Smith has not addressed whether her own staff, like her former chief of staff, Marshall Smith, was involved in the alleged misconduct. She's deflecting rather than confronting it head on. Then there's the perception damage control. By treating this like a procedural issue, Smith is allegedly minimizing the seriousness of the situation. That doesn't sit well with a public that's already skeptical of the UCP government. Then there's a potential conflict of interest. Smith hasn't recused herself from the investigation, even though the allegations involve people directly connected to her office. Critics say this compromises the integrity of the actual investigation. Now, to be fair, Smith insists that if wrongdoing is found, those responsible will be held accountable. But the alleged lack of proactive measures like independent oversight makes people wonder if this investigation is truly impartial. The political fallout from these allegations has been pretty swift. NDP leader Nic Maci is demanding multiple investigations, including a full RCMP probe, an ethics review, and a public judiciary inquiry. Advocacy groups like the Health Sciences Association of Alberta are calling for a freeze on private surgical contracts until a thorough investigation is complete. Some voices are even calling for Premier Smith and her health minister, Adriana Lagrange, to step aside while these investigations unfold. But has Smith shown any willingness to resign? No, of course not. Instead, her government is doubling down, defending their privatization efforts and the Alberta Surgical Initiative. They claim it's necessary to reduce surgical wait times, but critics allege it's more about benefiting political connected businesses than helping patients. So what does all this alleged controversy mean for Alberta's healthcare system? Pretty bleak. First, loss of public trust. People are losing faith in AHS's leadership. Political interference is proven. It could lead to a total overhaul of how Alberta's health system is governed. And then there's policy changes. If these allegations are substantiated, we could see major reversals in healthcare privatization policies. And then there's the political consequences. For Premier Danielle Smith and the UCP, the stakes are incredibly high. If more evidence comes out connecting top officials to these alleged contracts, it could severely damage their chances in the next election. Well, maybe. At the heart of it all, this scandal is about more than just contracts and politics. It's about whether Albertans can trust their healthcare system to put patients first and not profits. So what do you think about these allegations? Are they just political noise, or do they reveal something deeper about Alberta's healthcare system? I want to hear from you. Drop your thoughts in the comments below. Let's start a conversation about what's happening in Alberta. I'll see you in the next video, guys.